right, so first I would review the patient's chart. So I would check for allergies, current diagnoses, and then I would make sure that all my equipment is together. Before entering the room, I would knock, and then I would introduce myself. Hi Sally, my name is Shannon. I will be your nurse today. Bring in my equipment. Then I would perform hand hygiene, and then I would verify the patient's identity with her date of birth and name, and I would check the wristband also. All right, so today I'll be checking your vitals, and then we'll be doing a head-to-toe assessment. It'll take up to 15 minutes, okay? And then let's lift the bed up. Good body mechanics. Okay, Sally, so first we will check your blood pressure. Put this around your left arm here. Make sure that fits. Okay. Just relax your arm. All right, I got 120/60. Document that. Next, we will check your temperature. This will go in your mouth underneath your tongue. It beeped. 98.6. So then we would check her level of consciousness. So we would check for alertness, drowsiness, and then we would also check for her level of orientation. So I would verify where she's at, whether she knows her name, the situation that she's in, and make sure that that's times 4 for all of them. Times 4, I mean. Okay, so she seems pretty well oriented, responsive, and then we would move on to the head-to-toe assessment. First, I would evaluate her hair. I would note the texture, whether there's any balding, lesions, dandruff, and then I would move on to her eyes. Okay, so first we will do the perla to make sure that her pupils are equal, round, reactive to light, and accommodation. So I would turn the lights off during this, which they are off now. We'll check the left eye, we'll check the right eye, and the light on. I'd measure her pupils, which she's at a 3, and then I would have the patient look straight ahead, and I would move the pen towards the center of her eyes. All right, good job. And I would check for symmetry of the features of her head. So I'd look for symmetry in the eyes, ears, nose, and mouth. And then next, I'll evaluate the ears. So we'll look inside the ears and check for drainage, bleeding, or cerumen bilaterally. Okay, and then I would check in the nose and both nostrils and note any mucus, drainage. Then we would check the mouth and lips, make sure that there's moisture, make sure that her teeth and gums are intact and her tongue looks pink and normal. And then moving on to the neck. Okay, so we will do the lymph nodes and palpate for those. We'll feel for those both sides, moving down the neck, then back up. And then I would listen for and palpate first her carotid artery, and I would count her pulse in her carotid for 60 seconds total. Okay, 60 seconds is up. So then I would auscultate to note the rhythm, whether it's regular or irregular. Check for whether it's bounding, thready, normal, or weak. And I would auscultate that. All right, thank you. So then we would move on to the chest. First, we would ask the patient if we can check her breast by feeling for lumps bilaterally, and I would note any lumps, pain, lesions, and check for symmetry. And then after that, I would check for her apical pulse, which we'll locate, and then that's in the mid-clavicular fifth intercostal space, which is right in this area. And I would auscultate and listen to her pulse for a full minute. Okay, the 60 seconds is up, and then I would note any rhythms there, so we just want to make sure it's regular or irregular, and then we would count the pulse and make sure that there's no abnormalities there. So then after that, we would listen to her lung sounds, and then I would count her respirations here, and then I would measure expansion and the rate of respirations. And I would do that bilaterally after I auscultate her lungs. So I'll have you take a deep breath in and out. Take a deep breath in and out. Oops. Deep breath in and out. Deep breath in and out. We check it bilaterally on the anterior side. And then for the lateral side, we'll do that up and down also. Breathe in and out. Breathe in and out. Breathe in and out. Breathe in and out. And then next we would listen to the lung sounds on her back. So I'll lift her up, and we would go below the scapular line here, and take a deep breath in and out, a deep breath in and out, a deep breath in and out, a deep breath in and out. And then I would look at the shape of her spine, make sure that it's a soft S. Look for scoliosis, lordosis, or kyphosis. All right, you can lie back now, Sally. Then we'll move on to the abdomen. First, I would inspect the abdomen for any lesions, any swelling, redness, and I don't see anything. So then we would listen to her bowel sounds in all 4 quadrants. And not go over a minute for each quadrant. So I've listened to all 4 quadrants. Then I would palpate and look for distension or any lumps, and I don't note anything. Her skin does feel warm and moist to the touch. And then after that, I would inspect the perineal region, and then so I would check for any redness, burning, if they're having any problems there. And then I would ask when their last menstrual period was, and that's under the genitourinary system. I'd ask if they were having any difficulty urinating, so I'd ask when their last void was. And then after that, I would inspect the rectal area, and in that I would check for hemorrhoids, any lesions, and then I would ask when their last bowel movement was. So then I'm going to inspect the upper extremities. So we'll check both arms bilaterally. First, we'll do her range of motion, and I would do this to both arms. So I'd have her abduct, and adduct, abduct, adduct, flexion, extension, flexion, extension, and I would do that to the elbow. And then I would then feel for her radial pulse, and I would count that for a full 60 seconds, and I would do this bilaterally. So I can go ahead and feel for her radial pulse here. All right, and then I would note any abnormalities there. Then I would check the capillary refill on both hands, and I would do that to 2 of the digits here. And then I would check for strength. All right, Sally, can you pull on my hands? And her strength seems normal. Great. So then I would check for the pulses in the lower extremities. For the femoral pulse, that's located in the inguinal area, which is right in here in the inner thigh. And then for the popliteal pulse, that's located posterior to the knee. And make sure that we provide privacy at all times for our patient. And I would feel for that, which is posterior to the knee here. And make sure that the bed rails are up as I move down the bed. Roll this down. And then I would still check her skin for any edema, redness, rash, the temperature, which seems to be fine. And then I would do her range of motion on her legs here. So you do an abduction, adduction, flexion, extension, flexion, extension. And then we would measure her, her posterior tibial pulse, which is located in this area, and I feel it there. And then we would do the dorsalis pedis pulse, which is located here. We would do that bilaterally as well. And then I would check for capillary refill in 2 of the toes here, and then check for strength. So I would have her move her feet up against my hands, and then I would have her move her feet down against my hands. All right, and then we want to make sure we provide privacy for our patient. I would make sure that her call light is within reach. All right, Sally, here's your call light. Can I get you anything else before I go? She's okay. So then I would perform hand hygiene. Well, I would do that towards the end because first I want to make sure that she's at the lowest setting here before I leave the room. Okay, so I would perform hand hygiene, make sure the patient's comfortable. I would leave the room, and then I would record any abnormal findings, report anything, any equipment used during the procedure. I would document all of that. So then that concludes my assessment. Thank you.